Doctors at the MedStar Washington Hospital Center say Congressman Steve Scalise could be facing a long road to recovery. The House Majority Whip likely to spend weeks in the hospital undergoing multiple surgeries. His injuries worse than originally thought.
Usually the initial period is about hemorrhage control. And I feel like we've made a lot of progress about that, and hopefully that is not going to be our biggest enemy any longer. Other things to worry about include infections and other complications that come about from intensive care.
To discuss this further, I'm joined by Dr. Paul Saphier, who is a neurosurgeon. Dr. Saphier, clearly the latest prognosis for Steve Scalise is definitely more encouraging than it was at first, but talk to me more about the medical hurdles he's facing, short-term and long-term.
Sure. So, you know, the kind of injury, the gunshot wound that he had, what we call a transpelvic gunshot wound, is a very serious injury. A lot of people typically think of gunshot wounds to the head and chest as being very serious, and they certainly are. But transpelvic gunshot wounds, they essentially, when the bullet comes in one side of the pelvis, one side of the hip, travels across the pelvis and exits on the opposite side, a lot of vital structures can be damaged. Bones can be shattered, nerves can be severed, massive blood loss can be incurred. The intestine, the colon can have significant injury and leakage of very toxic substances. And so, just as you heard from his surgeons, the primary goal initially is to stabilize the patient. That's oftentimes in shock, as he was, controlling blood loss, doing emergency surgeries to assess the damage, stabilize bleeding if possible, and then sometimes numerous subsequent surgeries are also required to assess the further damage and also help repair additional injuries.
Okay, so you explained to me why there more than likely will be further surgeries. I read that the doctors are going to not remove all of the shrapnel, if you will, the gun pieces inside of Mr. Scalise. Right,
so oftentimes these bullets, when they enter, it's not just one small bullet that stays contained and goes through the body. It actually sometimes will shatter itself and throw debris that causes lots of different damage. Sometimes delayed subsequent surgeries are necessary. You can't, you know, we know that by doing one long surgery may not necessarily be in the patient's best interest right up front.
What are surgeons up against? I mean, we understand that you're dealing with vital organs. What's going on? What are the challenges for the doctors?
So up front, again, stabilizing the patient, as we heard, making sure that blood loss is controlled, and then subsequently we have to make sure that other secondary injuries like infections aren't or at least controlled or head off as best as possible. With regards to, you know, I don't know the exact injuries that he's suffered, but, you know, certainly there's a possibility of injury to the gastrointestinal system, the bladder, the urinary
But are these things that doctors can repair to get him back to on the road to recovery?
For sure, they can. It's just a lot more involved than we may classically think, or, you know, for people that are not familiar with it. You may think getting shot in the hip doesn't sound that bad, but the reality is this could be a very, you know, long process for him to go through in terms of surgery and recovery. But yes, he can recover from this.
And there's going to be, of course, the physical therapy afterwards, et cetera, right?
Oh, for sure.
Yeah, well, of course, you know, our thoughts and prayers are with his wife, Jennifer, and their 2 children, who are wishing him a speedy recovery, a full recovery, as well as we want to say thanks to those Capitol police officers, Crystal Griner and David Bailey, who saved a lot of lives on Wednesday. Dr. Saphier, I want to talk to you now about another medical case. The coroner is now saying that Carrie Fisher died of sleep apnea. How does that happen? I mean, I'm assuming partially it's because of lack of oxygen. How often does it happen, and can it happen to anyone?
Sure. So what the coroner published is that there was a buildup of fatty deposits within her artery, as well as a relationship of sleep apnea.
Is that like cholesterol?
It is. It's cholesterol. Essentially, what we say is cardiovascular disease, and that's cardiovascular disease is the #1 leading cause of death for both men and women in the United States, and actually globally throughout the world. There's a strong relationship between what we call sleep apnea and cardiovascular disease, as well as stroke and other issues. And sleep apnea, there's 2 main forms. There's obstructive and central sleep apnea. In obstructive sleep apnea, you're not able to breathe as well normally when you sleep, and that can happen for many different reasons. It can happen from lifestyle reasons, cigarette smoking, alcohol, also if someone is overweight, certain body characteristics, if you have a heavy, short, thick neck, a big tongue, other oral issues as well that can cause difficulty sleeping. or difficult breathing while sleeping.
But is it common for people to die from sleep apnea?
Well, we do know that there's a strong relationship between sleep apnea and a lot of other diseases like high blood pressure, like cardiovascular disease, like stroke. And oftentimes it is underdiagnosed. We think that there's about 3 to 7% of people in the United States that have sleep apnea. Oftentimes it's noted by people who have complaints of fatigue in the morning, headaches in the morning. They have numerous times getting up in the middle of the night. Their partners, their sleeping partners may notice that they're snoring or having periods of stoppage of breathing during the night. And if that's the case, they really should bring that to their medical provider.
Dr. Paul Saphier, thank you very much. We'll see you again.
Take care.